So that said, we are off to our final presenter, Miss Lisa Madron, who is the head of our community services. And Lisa, the floor is yours.
Thank you. Good evening, Occoquan community, and thank you, Supervisor Boddye, for inviting me to be a part of this town hall this evening. Thank you also, Jason, Emily, and Julia for helping get us ready for this. This is rather new for me, but I'm very pleased to be here this evening, particularly with my colleagues, Brian and Courtney, as a human services agency to Department of Social Services and Community Services sometimes can get confused, and yet we may share some clients at times. Our services are very different, so I'm very pleased to be able to speak to some of our services tonight. I'm just trying to get familiar with the slide. I will be talking about our services and treatment in community services this evening, the approved fiscal 21 budget requests by the Board of County Supervisors, and some of the impacts of COVID-19 on our services and our staff. Community services is the single point of entry into the publicly funded mental health, substance use, and developmental disability services. The county is mandated to establish a community services board by Virginia code, and Prince William Community Services was the first CSB to have been established in Virginia. As of last year, we celebrated our 50th anniversary, and now there are 40 other CSBs across Virginia. We are licensed and regulated by the Department of Behavioral Health and Developmental Services, and we serve residents of Prince William County and the cities of Manassas and Manassas Park who are affected by or at risk of developmental delays and disabilities, substance use disorders, and serious mental illnesses. We provide services in our two main offices in Manassas and Woodbridge, and in the community and in client homes. We provide treatment, and we help connect individuals to other needed services. We educate and advocate and engage individuals into treatment services that can improve the quality of their lives and oftentimes transform their lives. We collaborate with community partners around service needs, and we promote recovery and self-determination, empowerment, and resilience. As you can see on this slide, we offer multiple programs. We offer treatment and services through these programs for individuals and their families, basically from birth through older adults. The two programs that are highlighted in green here are added as a result of the fiscal year 21 budget adoption. Our treatment services include outpatient therapy, group and family therapy, intensive clinical case management, day support and psychosocial rehab services, psychiatric services, employment services, and we offer specialty team services. We're mandated to provide emergency services for individuals experiencing a psychiatric crisis or may be in need of psychiatric hospitalization. We're also mandated to provide outpatient services, primary care screening services, same-day access assessments, and case management services. Community services has many needs, and we often run waiting lists for several of our services. Thankfully, this year, the Board of County Supervisors approved funding for some of our most pressing needs, and they're listed here. The first program, the Mental Health Co-Responder Unit with Police, is a new program that was added based on the results of a pilot program that we collaborated on with the police department. We paired an emergency services worker with a police officer for responding to mental health calls. When an officer responds alone, oftentimes this can escalate the situation. This can take up to 8 to 12 hours sometimes of an officer's time and lead to hospitalization for the individuals involved. What we found from the pilot was that in almost all of the calls responded to, Having an ES clinician there who could intervene with the individual, help de-escalate the situation and address the crisis and get the persons connected to supports and services was far quicker, utilizing less of the officer's time and much more helpful to the individuals who were helped in a faster and kinder way. Intellectual or developmental disabilities. This program provides case management, which is a mandated service. Yet for those eligible for this service, that exceeds our capacity to provide it. So being able to support additional case managers and service coordinators to coordinate and monitor the services of the individuals, and particularly those that will be getting Medicaid waiver slots provided from the General Assembly, is very much needed and appreciated. May just happens to be Early Intervention Month, and our Early Intervention or Infant and Toddler program provides treatment and services like occupational therapy, speech therapy, education, physical therapy to infants and toddlers and their families who have a developmental delay. The annual growth in this program is around 7% per year. One of the outcomes for this program is that more than 50% of the toddlers that graduate from the program don't go on to require special education services. This funding will allow us to serve more infants and toddlers and their families and to address their delays and disabilities. Our peer outreach and opioid response is a team that allows us to continue to address the opioid epidemic and substance abuse challenges that we're facing in the county. This team began as a county pilot almost 2 years ago. We obtained a state opioid response grant that's scheduled to end this September. The grant uses peers to engage individuals in the community who are opiate and other substance users into treatment and services. And their engagements and connections have focused individuals where we've had the highest risk. Continuing this program will allow us to better engage individuals into treatment. New Horizons is our youth program, and there's a new high school that's scheduled to open the fall of 2021 in Bristow. This position will allow us to provide a clinician in the high school providing services and treatment to the students at this high school. We currently have a clinician in every high school in the county. The county board also funded the intensive in-home services program beginning January of 2021. This program expands our continuum of services for youth beyond outpatient and case management to provide the level of intensity and skill building services some youth need to be able to stay in their home or to return home sooner from hospitalizations or residential treatment. In addition to May being Early Intervention Month, May 7th, tomorrow, is Child Mental Health Day, designed to highlight the importance of mental health in youth. And I want to really thank our Board of County Supervisors, but especially Supervisor Boddye, for supporting this program and the need to expand the continuum of our youth services. The significant impact of COVID on community services that we've been providing has really been in our walk-in same-day assessment services, which we've had to stop and go back to scheduling appointments. We would frequently see up to sometimes 60 people. One day we had 95 people walk in for assessments prior to COVID. Clearly, we couldn't have people coming into the building in that number. And so we had to stop that, but we are still doing assessments, just appointments are having to be made. For the rest of our treatment and services, with permission from the Department of Medical Assistance and our Department of Behavioral Health and Developmental Services, and relaxing regulations, which were allowing us to increase our telehealth services, we've been really able to increase the engagement with the clients that we serve. We have exploded in our ability to offer groups to our youth and adult populations, and our staff are reaching out frequently to support their clients. However, we also have staff that are working in the office, in the community, and going into client homes when needed. We've experienced increased referrals in substance use disorders and the need for treatment services, particularly around medication-assisted treatment. And we've continued to operate our medication-assisted clinic in person 2 days a week. We've also continued to offer Revive trainings out of our clinic to help prevent overdoses and to provide Narcan. We recognize that this is a challenging time for our community, and our wellness and prevention specialists have been collaborating with various agencies and with Comcast around messages and online ways to address stress management, decreasing anxiety and isolation, suicide prevention, and Revive online trainings. And information about this can be found at our website. And my last slide provides information on getting to our website. I have an amazing staff who truly leans in to resilience when challenged. And although we have increased telework, as I indicated, we are working very hard in the community and in the offices and with clients. And in particular, some of our specialty teams, our emergency services staff, and our nurses are challenged as they frequently find themselves having to give injections to individuals or do assessments that don't allow them to social distance. Initially, we had some challenges with personal protective equipment and getting that for our staff. But thanks very much to the county and to Emergency Operations Brian's group, we have the PPE and the N95 masks that healthcare workers, because our staff are considered essential healthcare workers for the services and treatment that we're providing. We certainly have staff that are concerned about their health and the health of those they live with and what they're bringing home. And we value the health of our staff who are considered essential healthcare workers and work to help them maintain their physical and their mental health. They experience a lot of challenges because they're helpers and they want to support our clients. And we have had some clients who have confirmed cases of COVID. And we're working very hard to support those individuals and their families. For questions about community services or the resources on various topics, virtual support meetings that are happening, Revive training, suicide prevention, please go to the link for our community services website or call our office either in Manassas or in Woodbridge. Thank you. And if there are any questions, I'd be happy to take them.
Great. Thank you so much, Lisa. As always, just like with Courtney's team, you and your team are providing a lot of really vital services for our community. And I was proud to sort of help spearhead getting that in-home intensive program back into the budget, at least for starting 2021, because as I've talked to folks in the community, they are seeing a lot of parents going through some issues, having to basically raise their children now that kids are out of school, dealing with issues they necessarily didn't have to before. And we sort of all identified that as something obviously that wasn't an immediate need for right now, but looking into next year, and as your team ramps up the folks necessary to really make that program successful, I think it'll once again serve the youth of our community well and their parents. And it's interesting because I as you were talking about the telehealth and some of the other issues that Courtney was also talking about, both of you touched on the fact that the youth are actually really responding to it well. And so one of the questions that I got through Facebook Messenger here was about that. And have there been any, obviously the upside of that is obviously there's not so much travel time. Folks are able to sort of see each other immediately, and that we've seen the youth obviously respond well to that since they're used to seeing folks on screens and talking. How has that been in terms of the workload of your team? Is there any downsides to that? Is that, impacting folks? How is that sort of panning out with your team?
I think the only downside are sometimes the technological glitches that happen with Zoom or with WebEx or some of the technology. But for the most part, individuals are accessible. They are definitely willing and able, and oftentimes want to engage more often. So our staff are working longer hours in some cases to be available to clients, particularly because of the rise in anxiety related to COVID. But it's been great. It really, for our infant and toddler program too, one of the stories that was told was that we'll often have a physical therapist go into the home. And for a toddler, this new person in the home can be entertainment. But being able to zoom in, they're able to see some of the challenges or the behaviors or the issues that the parents are dealing with and talking about that they don't get to see when they're there. So it has been great. It's opened up a lot of doors. Definitely, we have 20 groups going on for our youth, the youth that have not been in schools, and they're on all kinds of different topics to really help and support the youth. We've got 12 substance abuse groups going on. We've got mental health groups going on for our existing clients, and we've been able to address some of the wait list because of being able to provide the groups. So it's been wonderful.
And this is Courtney. I would add, I think it's been great too. We have certainly found that people can be productive, and the not having to travel all the time in the car. For me, I've got programs all over the county, and there was a lot of time spent in the car, much less paying for the gas for it. So it's been very beneficial. I think we're learning a lot, and I think we're proving that county employees have integrity, can be productive, and we're getting the job done.
Excellent. So another question I got through Facebook Messenger, people like to Facebook message me. It's we touched upon a little bit during your presentation, Lisa, but it goes to both of you actually. So don't pop away too long there, Courtney. Are your folks, both your teams, are they well stocked with PPE? Do they have all the supplies they need, things like that? Because obviously we've heard that there's been shortage here and there in the hospitals. You know, the reports change daily on the status of PPE in the state, the Commonwealth, and our county and the community. But obviously your folks are part of the front line in some of these services, still making home visits, things like that. Are folks still well stocked in PPE?
For community services, definitely one of our priorities has been the N95 masks for those individuals that can't do the social distancing with the clients. And we have those and they're fitted. We are using them similarly to some of the hospitals, and that we're not throwing them away. Unless they're contaminated, they keep the N95 masks. And we just recently have gotten like a backup to that. Gloves have been an issue in terms of sizes of gloves, and we're getting the gloves. And we've got surgical masks that we're using for the clients that we're seeing and are coming in contact as a precautionary measure. I think some of the challenges have been, you know, with the changes in the media, many of our staff are sort of wanting all of it. Understandably so, just to be extra secure, and they don't really need all of it given the tasks that they're doing. So we're trying to get them what they need, have them feel secure with it, and then really utilize the higher level protective equipment for those that aren't able to do the social distancing that is really very helpful during these times.
Yeah, and I would agree. What has been a challenge for me, I'm not an expert in isolation and infectious disease and in what kind of masks you use when. So we've all had to learn about that. And it has been a challenge, particularly at the beginning, because the equipment went to healthcare workers and public safety, and it should. And we all know there wasn't enough of it, but it took a while for those of us like Lisa and myself, whose staff provide essential services, for there be a recognition that, wait a minute, we've got a whole nother group of employees that are in harm's way, that are going into homes, that are, you know, meeting members of the public who are vulnerable and therefore may be exposed. We have had outpouring from local community sewers who have provided homemade cloth masks. That has been particularly helpful because as it first started, everything was concentrating on staff, and we support that, but we also serve a lot of people. We have youth at the juvenile detention center. They need masks. We have people at the homeless shelter, people at the hotel, the overnight shelter that we are serving, and they deserve a mask too. So we have learned, you know, who needs the N95, who needs the cloth mask, and who needs the disposable surgical masks. That's taken us a while to get through all that and to have enough. I feel like that is improving greatly day by day.
Absolutely. That's helpful. And that's why I sort of pitched this to both of you, because like was just said, you know, we wanted to prioritize our actual, you know, definitely frontline folks in terms of hospital workers, doctors, nurses, folks that are dealing with folks who are the most extreme cases. But again, just to the point that both Courtney and Lisa pointed out, we have a lot of folks that are county staff that are currently still having to interact with folks person to person, make sure that they're being served. And the last thing we want to do is endanger our county staff, or to the point, endanger some of the folks that we're serving, not knowing someone's asymptomatic yet, what have you. So we don't want to exacerbate problems by not making sure that our own folks are equipped as well. So I'm glad to hear that you guys have sort of worked through those issues. And my hope is now that we're in a place where we've had to work out some of those buckets of what needs what kind of mask, should this, God forbid, happen again, or we see a resurgent, or we get any sort of other pandemic like this in the future, which is entirely possible, we have some of this stuff worked out already, so we're not reinventing the wheel. I just saw Brian pop up. Is there anything you wanted to share, Brian?
Yeah, so thanks for that. And just to add, that is absolutely one of the planning efforts that we're working with the team and the EOC on. We have placed several very large orders, and we know they're months away, and in some cases we're on allocation for vendors. So there's a variety of ways we're doing that. A lot of it's through some of the regional collaborative purchasing. So we're using the bulk buying power of all the partners in the National Capital Region. And some of the orders we placed early in the event are slowly starting to trickle in. So we're in good shape, near term, long term. Ms. Tierney mentioned just some of the challenges getting people fit tested and everything. And we just had a very large order of the fit test solution that's used for that process show up yesterday. So we are seeing a little bit of improvement in some of the supply chain. And we've talked with county leadership about the long-term needs, and we're going to be keeping much more on hand and kind of trying to streamline the single model number part of things so that we have more of it on hand moving forward. So we're as Ms. Tierney and Ms. Madron mentioned, it was a little bit of a challenge just getting enough out there to start with, but we're quite comfortable with what we have and what's been ordered. So thanks for that question.
Let's see if there are any other questions. Yeah, there is. 1 second. And as the next question gets pulled up, I know that we sort of discussed this a little bit when we were doing our test run, but it's also my hope that as we get out of this crisis, we can help get some of those changes in policy that were implemented as temporary measures that have really helped your team be more flexible, not having to travel as much, see more people in a much more efficient manner. I'm hoping that we can make some of those more permanent. So, you know, we should be not only getting back to normal, we should be readapting to the new normal, which is being able to serve folks wherever they are, especially as we've talked about, you know, certain segments of the population, you've been able to serve better as a result of these changes. So it's my hope that we can really work with our folks on the local, state, and federal level to make some of those silver linings a more permanent thing. And now the question has popped up in there. Is there a fee structure for community service programs? And if so, are they covered by insurance, Medicare, Medicaid, et cetera?
We offer a sliding fee scale, and getting services should not be, or affordability should not be a barrier to getting and accessing services. And that's why we often run a waiting list, because being a public agency, we often serve the folks that have no other alternative. they don't have Medicaid, or they have Medicaid, but they're limited Medicaid providers in the community. So they're coming to us, as well as those that have insurance come to us. So we do take insurances and we work on a sliding fee scale to make it affordable.
Absolutely, and I think that that's a very, very key point, and that's why we still have advocated for deep investments in the services that both Lisa's team and Courtney's team are offering, because we obviously we have great community partners that are in the nonprofit realm, that in the private realm are obviously our private health insurers, our health providers are all part of the team. But frankly, there are just some folks that can't be served by those entities for one reason or another. Part of that is affordability. There are obviously just some organizations that they won't serve people either because they have their needs are too great, or because they don't have the means of really paying for that. And that's really where Lisa's team and Courtney's team really come in to be that ground level bedrock of the social safety net. And that's why, especially now that so many folks, as Courtney and I discussed previously, are losing their jobs, are falling into that lower income bracket where they may not be able to afford things they were able to afford before, that we have that net and it's being reinforced. That said, we have another question. Since telehealth is having such a high level of success, will telehealth continue being being an option post the COVID crisis?
I sure wish and pray that this will. And this is where the advocacy kind of comes in, because as it stands now, private offices or vendors in the community that offer outpatient therapy, for example, that don't go through Medicaid or DMAS for reimbursement, can offer telehealth from home to home or office to home. We cannot, through Medicaid regulations. And that's what's allowed us to do this, because DMAS has relaxed their regulations. Our state organization, the department, has permitted that. But when things go back to normal, that's not allowed. And just for an example, we have been able to do telehealth with psychiatrists before COVID, but that requires the psychiatrist, for example, may be at home or in one of our offices, but we have to have a staff person with the client in the office. That is really hard for the individuals that could really benefit from this service in their own home or in the community, like's happening now. So I would love to see this continue, because I think it would be beneficial, but it's up to the state and federal regulations.
Absolutely. And just for the folks at home, I see you popping up there, Courtney, just a second. So Lisa, could you remind folks on the phone and online what DMAS stands for?
Department of Medical Assistance Services. So it is the federal department that reimburses us for some of our services.
Courtney?
Just going to add that telehealth we are using it significantly with persons experiencing homelessness. And GMU, George Mason University's MAP clinic, that is Mason and Partners Clinic, is so very helpful. They do work particularly for persons that are underinsured or uninsured. And they are doing the triage at the shelter at the Dale City Rec Center. They are helping us with those that are positive or in quarantine or very sick with underlying conditions in our hotel system. And they just stepped up to do it, and they do it via telehealth, and it is working really well, not only for them, but particularly for persons experiencing homelessness. They adapt to it very easily. So I'm with Lisa. I hope this will continue.
Right. And an interesting synergy there is how a couple of weeks ago, both on our side and the school board side, we're looking at expanding more areas in the county that offer Wi-Fi hotspots. So obviously the one sort of barrier to a lot of folks getting telehealth is access to a device that allows them to see folks, or access to a phone or access to Wi-Fi on their computers to access those telehealth, those virtual services. But we are obviously looking at ways to help expand our footprint in terms of Wi-Fi, internet access to the community. So as we move out of this, we are able to make those offerings. And what I will say is, just to reinforce it again, some of these relaxations of guidelines and restrictions are at the state and the federal level. And so obviously, once we come out of this crisis, there'll probably be some talk about, those regulations were there to begin with for sometimes really very good reasons. But this has shown us that we can serve a lot more folks in a lot more varied and flexible ways, not only for them, but for our clinicians and everyone who's helping them, and really help a lot of folks have a lot better outcomes. So that being said, obviously, once we get out of this crisis, we get closer to the next General Assembly session, I will be sort of working with both Ms. Tierney and Ms. Madron and their teams on working with our General Assembly partners and our federal delegation on how we can really streamline these processes so we're having the best outcome for folks and we're being as most effective and efficient as possible with our delivering of services.
Thank you.
So I think that was the last question. At this point, it is 7:27. We are billed to have this open until 7:30. So Brian, Lisa, Courtney, thank you so much for joining us. Was there anything the three of you wanted to add before we wrap up?
Wash your hands, socially distance, use
Take
a
your
mask,
temperature.
take your temperature, be careful.
Yeah, and just as we look towards trying to get back to some sense of normal as a community, we just ask everybody to be patient and keep following the recommendations that the governor and the local officials are giving. We know everybody's kind of got cabin fever, and it's been a tough couple of weeks here. But as Courtney said, wash your hands, don't touch your face. Still telework if you can. Still practice social distancing. This will pass, but if we do too much too soon, then we could have some little spikes that we'd rather not see. So just keep being patient, and we'll be as open and honest with folks about information as we can be.
Absolutely. Yeah, so on that note, again, everyone on the phone and online, thank you so much for joining us. If you have any further questions, concerns, issues, our office is here. These three excellent public servants are here to serve you. We know that this has been a trying time for folks, whether you're experiencing some of the hardships, the direct impacts of this COVID crisis, or some of the ramifications on a ripple effect level, like you can't go, spend time the way you've wanted to. You haven't been able to see friends, family the way you've wanted to. We know that every segment of our population here in Prince William has been impacted by COVID in one way, shape, or form. But I also hope that, as with our county government, this has given folks a newfound appreciation for our frontline folks, whether it's our healthcare workers or the great folks in both our social services, our community services department, and our emergency response personnel who are really out there every day making sure that we weather this crisis as best as possible, and that we're not only setting the stage for us to have a recovery, but to make our community more resilient. So should things like this happen in the future, we're in a better place to sort of respond to it and stay healthier as a community and as individuals than we were before. That all said, again, this is recorded. We will be releasing this video on our website. We'll actually be slicing it up into each individual presenter as well. So if folks only want to hear from Brian, although there's really great stuff that Lisa and Courtney talked about, they can just hear from Brian. Or if they want to just hear from Courtney on her stuff, we'll have a segment on that. And the same thing with Lisa. We're not going to really chop up my part because no one wants to hear me talk. I have really great experts on here that could speak to these issues a lot better than I can. That being said, folks, again, thank you so much for your time. Stay well, stay safe. Lisa, Brian, Courtney, again, I cannot thank you enough for joining us tonight. We are very blessed as a community to have you serving us in the public sphere.
Thank you. Good night.
Thank you. Good night.
Good night.